Hi all, I am Dr.Hirennappa B Udnur, Pulmonologist practicing at Inspire Specialty Clinic, Sahakar Nagar, Bengaluru. Dry cough, especially a dry cough, acute dry cough, it is viral infections related, or sometimes it's exposure, dust, or sometimes allergens or severe irritation, foreign body. These are the acute causes for a dry cough. So it can start with a dry cough. They have associated symptoms like fever, throat ache, sinus, post-nasal trach-like symptoms, sneezing, and other things. Based on the constellation of symptoms, we classify and diagnose the cause like upper respiratory infection, acute pharyngitis, laryngitis because of change of voice is associated. Sometimes wheeze if the airway is involved. Bronchiolitis can cause breathing difficulty. Oxygen saturation if the pneumonia is diffusely involved. So this is the way we look at the causes of pneumonia. Dry cough, if it is acute or a chronic dry cough. Acute dry cough might be because of viral and other things, foreign body, exposure to dust, smoke, and other things. So they can go symptomatically by treating the symptoms. It might be pneumonia and all. Usually the cough which is persist more than 6 weeks to 3 months, we normally address that. So dry cough, there are many causes. Dry cough associated with weight loss, blood in the sputum, evening rise of temperature, it might be TB. Dry cough, it can be pneumonia with pleuritic chest pain, it might be empyema. Dry cough, it might be just ear wax. Dry cough, it might be just throat infections. If the dry cough, which is sometimes due to a reflux or a cough variant asthma or a post-nasal drip, these are the common causes of dry cough. So when you see the associated symptoms with a dry cough, which is chronically persistent, when it is associated with chest tightness, so dry cough in a background of allergy and atopy, he has some sneezing, allergy, and it is a long duration with a positive family history with IG is elevated, with X-ray being normal and other things. It is associated with chest tight, it might be a first symptom of asthma. So whenever it's a dry cough, it's a subtle symptoms. So all the symptoms, all the evaluation might come normal in these kind of cases. So when you see the X-ray can come normal. There's no mediastinal lymph nodes, no pleural effusions, no pneumonia, and there's no history of any infections. Then dry cough can be a reflux related. We take GI symptoms are there. Sometimes you give Pantodac, it will improve. Sometimes we look at only in the chest, or it might be in the nose, that sneezing, post-nasal drip, and sinus examination, X-ray PNS. If all these things are known, only isolated dry cough and which is happening in the night times, early morning with chest tightness, it might be a first sign of cough variant asthma. Even the PFT can be normal. Normal PFT will not rule out asthma. So then we see a peak flow monitoring devices, and we see morning and evening, these kind of things which we see, and we monitor and we diagnose asthma. They have a component of exercise induced asthma and this associated with a dry cough. Whenever they run a bit, they get a dry cough and chest tightness. If you have early morning, 3 o'clock, 4 o'clock, they get up with a wheeze. If when it is not associated with wheeze and isolated chest tightness and dry cough, sometimes it is very difficult. Then we look at IG AEC and we do the PFT. There are newer tools like Pheno where the nitrous oxide is elevated. We confirm the diagnosis of asthma in these cases.